So yes, I mean, you did face a lot of opposition when you proposed expanding the ULEZ zone in London, didn't you? So what is your research telling you about the impacts as you see them?
Look, people may not realise this, I didn't until a few years ago, but no level of air pollution is safe. It can lead to thousands of premature deaths and a whole host of health issues from asthma to cancer, heart disease, strokes and dementia. And what this 1 year's worth of data shows, and it's been analysed and checked by international experts from Imperial College, from Germany, from Belgium, from France, from York University, is the ultra-low emission zone works. It's led to substantial improvements in air quality in London. The three big pollutants, poisons, are nitrogen dioxide, nitrogen oxides and particulate matter. We've seen across London a 27% reduction in nitrogen dioxide, a 36% reduction in NOx, and a 31% reduction in particulate matter in outer London. And that means all of Londoners, almost 10 million, are now breathing cleaner air. And in 99% of the air quality monitors, we saw a massive improvement in air. And here's the really good news that I'm really proud of. The quality of air in London is improving much faster than the rest of the country. So we're breathing cleaner air, which means longer lives.
Well, Heidi Alexander is now Transport Secretary. Some people have described her as the architect of ULEZ, and she's supposed to be a fan of 20-mile-an-hour zones as well. So do you expect similar low emission zones to be, and the costs and the fines that go along with them, to be rolled out across the country now?
What we shouldn't have is a one-size-fits-all approach. What's right for London as a policy may not be right for Luton, because it depends on
the principle of these zones. Do you think that they will happen in cities up and down the country?
I think the principle of us recognising air pollution is bad and we've got to clean it up is really important. If we were speaking 60 years ago, there'd be a discussion and debate about whether tobacco is dangerous and whether we should reduce smoking. I'm hoping now people know the science is quite clear. Air pollution causes harm, but there are now policies, world-leading policies, to reduce air pollution. And international experts tell me there is no one policy that's had the impact on air quality improvements that ULEZ has had. And I'm hoping other cities, and we've seen some cities already doing it, Bristol, Oxford, parts of West Yorkshire, will introduce their own clean air zones.
But some motorists might say, I get that, but it's costing me a lot of money, and if I don't know about it, I get fined for it, and it's a bill of hundreds of pounds. And the Tories, meanwhile, will say that you're waging a war on motorists.
Well, look, this has not been anti-car. This has been anti-poison. So in London, we've seen the non-compliant cars go down by a huge amount, and we've supported financially almost 69,000 cars to be scrapped, and they've been replaced by cleaner vehicles. So where it's possible, clearly it's better to use active travel, to walk, cycle, use public transport. But where it's not, of course you should be able to drive. The point is, often you don't realise, by driving a polluting vehicle, you yourself are breathing in poison, your kids in the back are breathing in poison, and those around you. What we've seen in London is actually cleaner air in central London, in inner London and in outer London. And the big prize is actually it has had no negative impacts on retail expenditure, on leisure expenditure. Footfall's gone up in outer London. ULEZ is not about making money. In fact, I've said 97% of the vehicles are compliant. They don't pay a penny for driving around London, but see the benefits of cleaner air.
So when it's fully successful, there will be no money raised from it at all? Is it a slightly anomalous state of affairs?
Absolutely, and you can look at the TfL budgets year on year. ULEZ brings in less money, but also we've invested a huge amount in the cameras, in the IT kit, in making sure we've got the right staff trained, in the scrappage scheme, which has led to the hundreds of thousands of vehicles being taken off our streets. And we know we'll be saving money in the medium to long term, indeed in the short term, for the NHS, for social care, and for those businesses who won't be having staff ringing in sick because of asthma.
Sadiq Khan's self-congratulatory stance on the expansion of ULEZ is yet another example of his shameless political opportunism and utter detachment from reality. The irony is almost comical. Boroughs that opposed his draconian money-grabbing scheme have seen the most significant reduction in pollution, yet he has the audacity to present this as some kind of personal triumph. This is the same man who dismissed legitimate concerns from working-class Londoners, small businesses, and countless others who rely on their cars, branding them as obstacles to progress while fleecing them with outrageous daily charges. His claim that ULEZ is not anti-car is laughable at best and outright deceitful at worst. If it's not an anti-car policy, then why does it disproportionately punish those who cannot afford to replace their vehicles? Why were alternative, less punitive environmental policies ignored in favor of one that conveniently funnels millions into City Hall's coffers? Sadiq Khan would have Londoners believe that his motivation is pure environmentalism, but in reality, this has always been about revenue and control. If he truly cared about pollution, he would focus on broader infrastructure improvements, better public transport, and incentives rather than a regressive tax that disproportionately hits those who can least afford it. The fact that boroughs opposed to his expansion have still benefited from air quality improvements only reinforces the absurdity of his policies. He imposed an unpopular tax under the guise of environmental concern, and when positive results occur in areas that fought against him, he shamelessly takes credit. It's the political equivalent of pushing someone into the water and then demanding praise when they learn to swim. His arrogance knows no bounds, and his blatant disregard for the financial and personal struggles of ordinary Londoners proves that he is more interested in political posturing than in real leadership.
Now, in its typical out-of-touch fashion, the BBC has claimed, out of nowhere, that mass immigration is saving the National Health Service from a crisis. Now, you can see what you will have seen on the BBC website this week, not particularly a story that seems to have any relevance to anything going on other than the BBC wanting to tell us that migrant workers are saving the NHS. Now, there's no doubt that we do use foreign workers to fill gaps in the NHS. Of course we do. But what is this narrative that is being imposed on us? Arguably, it misses many things. Not only the fact that migration adds a huge demand problem to the NHS. Remember those government forecasts, about 10 million people coming into the country still between today and 2047. Enormous numbers of people still forecast to come into the country. But there are also serious questions about the quality of talent that we are recruiting into the NHS. Now, one man who has tried to sound the alarm on this in the newspapers is the writer and former surgeon Marion Thomas, who joins us in the studio tonight. He also, I should say, happens to be my uncle, as well as my panel contributing editor to Novara Media, Michael Walker, and assistant comment editor at The Telegraph, Poppy Coburn. Marion, you've written about the pressures facing the NHS, but more importantly, you've raised the question about who we are actually bringing in to work within the National Health Service.
Correct. So in 2024, we trained just over 9,000 students in this country.
British students.
British students.
Yep.
But students are trained in the UK. And also in the same year, we imported more than 19,000 doctors from abroad, mostly from low-income countries, mostly from India, Pakistan, Egypt, Nigeria, Bangladesh even. And my grouse has been this exam called PLAB, Professional Linguistics and Assessment Board exam, which I think is not fit for purpose.
This is the exam that doctors do to become doctors?
No, the people from abroad are already qualified in their own country.
Yeah.
But as we know, there's a huge problem with corruption in medical schools in India and Pakistan, for example. You've just got to put that into your Google search and up they will come. So when they come to this country, we should discriminate the excellent from the good from the bad. And we should... We have an exam called PLAB, Professional Linguistic and Assessment Board exam, and I think that exam is not fit for purpose. For example, we know that the pass rate should be increased by about 30% to reach equivalence with British medical students.
So what you're saying is the people who are coming in, who the BBC are saying, look, aren't these people wonderful, they're saving the NHS, in some cases, or indeed many cases, they're often not as qualified or as experienced as their British counterparts. And at the same time, we're not actually allowing more British kids to enter medical school because we're capping the places.
That's absolutely. I'm not saying all the doctors coming from abroad, but a proportion, yes. And my other problem is they come in from these countries and they've had no experience of our culture. They've got absolutely no experience of working in the NHS. And what induction do they get to work in a totally alien system? That's